Now at 5, the number of women who die during pregnancy or shortly after birth has been increasing steadily over the past few years, 20 years in fact, according to the CDC.
Nevada is hoping that doulas, which give emotional and physical support during pregnancy, can help improve birth outcomes. Fox 5's Alexis Fernandez tells us about the growing profession.
Well, Jacqueline, John, over half of all births in Nevada are reimbursed by Nevada Medicaid. The state is now offering more money to doulas to help low-income mothers who may not have access to traditional health care services. Before Monica Broberg gave birth to Ridian 3 months ago, she wanted more help delivering her first baby.
After seeing my sisters and what they went through in their births and everything with their children and them not having that support, that's what made me want it.
She had a high-risk pregnancy, so she hired a doula that was offered through Medicaid.
I think coming from a woman and coming from somebody who's been there, it comes off a lot different. You know, they have the intention like, I've been here, I've experienced this, I know what you need. If you tell me what's going on, I can offer you support.
A doula is a non-medical trained professional who provides emotional and physical guidance during pregnancy and after birth. They've been around since the 1970s.
We're here for support. We are that person that answers those questions that you're like, is this right? Is this normal? Should I be feeling like this?
Doulas are not licensed or regulated and can cost a couple $1,000s, which is not generally covered by private insurance. Medicaid covers doula services in more than a dozen states, including Nevada. Christina Gibbons became a postpartum doula 3 years ago and now works with Vegas Family Doulas. She says many mothers describe the birthing experience as traumatic.
It was not a great experience. And then so with that second one, they're like, I just need somebody there that's going to give me the answers and help me and make me feel supported. Sometimes they don't get that support from their partner.
According to the Centers for Disease Control and Prevention, doulas can be valuable for populations that don't have access to health care services and can help bring down maternal death cases, which have been on the rise over the past 20 years. Nevada recently increased the reimbursement rates from $350 per pregnancy to $450 to attract more doulas.
Getting our foot in the door to possibly see that more people want this service, and then because more people want this service and are utilizing this service, maybe we can get more in, years to come, months to come.
And ultimately prepare new mothers like Monica for parenthood. Because the industry is not regulated, it's unknown how many doulas there are. The cost to become a doula can vary depending on where you get certified. The UNLV School of Nursing is now offering a course which costs $1,000 and takes 32 hours to complete.